Good afternoon. As you already know, this is Speak On It. My name is Malik, and yes, we have guests tonight. You already know the number here is 312-738-1060. And this will be the last episode for this quarter as it relates to the awareness. I'm going to use the word campaign, but you already know I'm not comfortable with the word because it sounds political. But it is an awareness initiative. That's a better word, isn't it?
It's a great word.
Initiative is better than campaign. Awareness initiative. And one of the things we're going to do before we have the guests to come on who are partners or participants with the task force is summarize just with a few headlines, just to remind you of why we was here. Now, what you see, see that's them bifocals. When you have to do all this here, them bifocals. This piece you see here, in the last few hours, over 8 people have OD'd in Joliet. Now, that's in Joliet, but it's still part of the same thing and theme that we've been talking about. And as we continue to go, there will be another piece up here. When he get that one ready, we'll show you that one. Whereas 3 of those people have died, just bam. Somebody was telling me just today around the school that there was a person, people saw him laying there and they thought he had failed and busted his head. But somebody thought he was breathing, and I guess he was. And somebody said, well, does he do dope? So the paramedics popped him and he came back alive. But it was the Narcan. So a lot of people have suffered, but now we can redirect them to another chance at life. That's what this initiative has been about. This quarter has basically been an educational opportunity to share information. Once again, if you need to see any of the programs we have done in the last 10 or 12 weeks, you can always go to CAN TV, Nonprofit Services, Retro Current Team. Then that'll get you access to these programs. So that's a simple matter. Tonight we'll be on a little bit longer, so if you got some questions or whatnot, you can come on with them. Will you give me the other, Amari, give me a couple of those other pieces, because there's one piece, this piece here is sort of painful. It's painful because when you look at this man and woman and you look at the caption, 11-month-old baby ODs, because his mother and his father OD'd. And as a result of them ODing, he got a hold to this substance and he too OD'd. But once again, the medical providers was able to get to him in time to bring him back. And I like to use the word bring him back because, see, you all need to understand this. For all practical purposes, if they didn't have Narcan, they'd be dead. So when I say bring them back, I am very serious when I'm talking about resurrecting people from the dead. That's why when we talk about these trainings and getting familiar with this particular drug, if you can call it that, we need to sign up for that. When LaShawn Ford and the people that he worked with in his district made this initiative a priority, that was a good thing. But in order for this initiative to survive all of the other stuff to come up, we have to continue the momentum. So we have 2 guests here tonight, and they're going to just kick it whichever way they want to. So y'all tell us who you are, why you are, and where you from. All right?
Well, Dr. Malik, thank you for having us on tonight.
No problem.
My name's Amanda Brooks. I'm the Chief Population Health Officer at PCC Community Wellness Center. We're a federally qualified health center that serves the west side of Chicago and the western suburbs.
Okay.
And I'm Katie McDonough. I'm a family physician, board certified in addiction medicine as well. So I'm the medical director of our chemical dependency services at PCC.
Okay, and what are you all's involvement with the Westside Heroin Opioid Task Force? How do you all fit into that? I don't want to call it epidemic, but that epidemic that we are suffering now, as we see not only in the Chicago area, but also in the, that's another piece, Joliet area, And I'm using Joliet simply because we all know it's just a spit away. And we know that Joliet and Chicago probably sharing the same substance. So all of this fit. And I guess my question would be, or should I say is, and you all just handle it the way you feel free, how do we really take it to the next level after we talk about training and education and awareness?
Yeah, and I think it's important to kind of set the groundwork and kind of so we understand what role we play with the West Side Heroin Task Force and with the opioid crisis. PCC is a family medicine provider, but we are the largest purveyor of integrated substance use services on the west side of Chicago. Now, what does that mean? Right? It means that Dr. McDonough is a family physician. I'm a social worker. We say that no patient will be able to reach a point of long-term recovery without both medication and medical support, as well as behavioral health support. So we have to both treat the addiction and the behaviors that are associated with it to support a person into long-term recovery.
Okay. Well, I guess back in the day when I was a practitioner in social services, we called it wraparound services. And I guess sometimes people think that you just give them some Narcan and he wake up and he'll be all right. Just long enough to get another shot of dope.
It's just, yeah, it's so much more complicated than that. So as Amanda said, I think the thing that makes our program stand out is this integrated approach. So it's a one-to-one ratio of medical provider to behavioral health consultant. And we always joke that, I'm like 20% of the equation prescribing the medication, but there's so much more to it. Offering those behavioral health services, identifying triggers, relapse prevention.
And so our main support is with medication is buprenorphine or Suboxone. So it's the treatment of the substance use disorder with the medication. It's also co-prescribing Narcan so that because we know addiction is a chronic disease, even people in treatment may continue to use or dabble in use. And so we want them, if they get a bad batch, to be able to have the Narcan available. We also know that we're not on the streets. We're not the ones necessarily that may identify somebody, a friend, a family member of the patients that we serve who may also be using. So we want them to be armed with Narcan so that even if it's not for themselves, they can help their communities and ensure that we flooded the West Side with as much Narcan as possible.
Now that's interesting because that is a piece. Now, the person with the disorder can actually be trained to administer?
Yes. So the form of Narcan that we prescribe is the nasal spray. So it's quite easy for patients to use, for families to use, and there's a video that we show them. We send them home with a quick start guide on how to use it, when to use it, and we give them many refills. As Amanda said, our philosophy is just to flood the streets with it. So not even necessarily do we limit it to our patients with substance use disorder, but anyone that's a patient at PCC receiving like a monthly prescription for opiates to deal with chronic pain or even benzodiazepines, we give everyone Narcan because I think addiction and substance use disorder is something that affects everyone in some way, shape, or form. And so I think it's just beneficial to the community to have it out there and to educate everyone on how to use it effectively.
Okay, and I think this is a good time for you all to do a shout out to you all shorties who are looking at the show. Go on and let them know that y'all know they looking. All right.
Hi, Elliot.
Hi,
Ellen. Hi, Jack.
See that? And see, that's part of the whole energy I think we have tried to have as we went forward the last few weeks. We want people not to be caught up in the spookism. Substance abuse is abuse to those of us observing, but it's not abuse to the person that's struggling. The person that's struggling is actually trying to survive. So unless they can get holistic, wraparound, integrated services, they will more than likely end up in quicksand. So we have tried to have guests in the last few weeks that could give us a different perspective. Now, y'all already know I have my own crank style, and I snapped the other day on the other thing we do, And sometimes you have to talk the language of the people that are engaged in the discussion. And part of what we need to understand is the governor made a decision today, and one of the senators that, I don't know if it's a senator, a state rep, whatever she is, he will make her, not make her, but she will become, I'm going to say the director of the cannabis, whatever they're going to call that. Now that's a hell of a thing, because what's going to happen is this. That wasn't no curse, y'all. I'm talking to y'all children. When I say hell of a thing, I'm trying to be using profanity for y'all. But the bottom line is this. She must be given a big incentive to leave public service to administer something that she helped bring into being. My question to you all is, what happened to old school people like myself that thought and was taught and taught others that marijuana, they call it cannabis now, marijuana was a gateway drug, because back then you treated it like it was a dope. Is there a danger now that with all of the energy people putting into opioids and heroin, and some people somewhere on one of these clips, somebody laced some cocaine with fentanyl, and man, it just went crazy.
Yeah.
So now I understand they vaping marijuana. So that's another thing. It's not going to your lungs. It's going straight into your system, and people, bam, going out. So what's going to happen now that cannabis is the new thing, but it's also the old drug?
Yeah.
How is that going to affect what you all trying to do?
I think it's important to know that the marijuana of today is not the marijuana of the
Exactly.
70s. And there is no medication-assisted treatment for marijuana. And there's a lot of information we don't have about the way that marijuana impacts the body, the brain, the development, particularly for young people. We're really just learning that now. And it is a challenge for the patients that we serve, because we do find that a number of our patients, actually most of our patients, have polysubstance use disorder. So they're not just using heroin, they're using cocaine, they're using marijuana. And it is a challenging conversation, particularly with marijuana at PCC, because there's a belief that this is, it is natural, it is organic.
Benign.
It is benign. Yeah, that's a great word to use. And so it is, it's an easier conversation to have about heroin, because we can feel the physical effects of withdrawal,
Right.
than it is to understand the effects of marijuana, and in many cases cocaine too. It's not the same sort of withdrawals and dependence that we see develop with heroin.
But I think to your point, we're seeing that fentanyl is being, many substances are being laced
Exactly.
with fentanyl, and, where will it stop? So we at PCC have had patients that have overdosed on cocaine, laced, fentanyl-laced cocaine, and, I wouldn't be surprised if there's fentanyl-laced marijuana too.
Oh, there is. I'm just taking from a dude that's on the street with his ear down on the ground. Yes, there are people that's falling like flies because they vaping and they're not understanding that now when you pull that, whatever that device is, the pressure give you a different type of speed. So bam, it's over with. You all know it better than me. I don't know. I don't get off into that. I just get out and listen to them kick it around, and I'll be listening, and some of the stories they tell, how all of this stuff is sort of like interlaced. I think that we might find that this person that he got Omari got something on the screen here that I need to show you all. I know you can't read it, but just look at it. It says, marijuana, how can it affect your health? Now, that's a question you all need to be trying to figure out, because you all are celebrating, and I ain't hating, you all are celebrating the fact that it's legal. That's cool. That's cool. It's going to get you some money. But Naperville say no go. A lot of other places say, no, we don't know the damage. But one thing they did say, and LaShawn Ford said it right here on this show, that they already know that until you at the age of about 24, your brain is not really fully developed.
Right.
And I do know that I know young people that's been smoking marijuana for ages. They will tell you right now, and they're almost 40, that they know they killed some brain cells. Because they can realize it now that they have come through that romantic phase of smoking a joint that they sort of slow in the head. Now they're saying that it might be good for older people like me. So you don't want to be senile, maybe you need to get you a joint and just go and get a buzz. But regardless of which, and they had some rats, I read it in the day, they had some old rats, and they gave them some marijuana. You know, of course the rats did better. They did as better than the young rats that had not had the marijuana. But then they took the young rats, and they gave them some marijuana, and after a minute, the young rats got retarded. Now I say that to you all that got children. Now you finna let your children do this. 30, 40 years from now, we will have a DNA crisis where we won't be talking about heroin and opioids. We'll be talking about what might have happened when we were trying to get the money to save the pension. Right or wrong?
Well, what we do know about marijuana.
I'm gonna get to you in a minute, Carl. Excuse me. I'm coming. But just hold on for a second.
What we do know about marijuana, we've learned a lot from what's happened in Colorado. We know that rates of motor vehicle accidents have gone up. We know that truancy rates at schools have gone up. We do know that patients with a predisposition for psychosis, so schizophrenia, that the use of marijuana can stimulate that first psychotic episode.
There have been more instances of ingestions in, youth, getting a hold of, parents' medical marijuana or...
See?
We also know, there's some evidence on the developing fetus, so we can see issues with emotional regulation, developmental disabilities, delayed gratification, and these are going to often be the kids that grow up and we say, oh, they've got ADHD or they've got behavior problems, they need a 504 or an IEP, and these are things that can be avoided, right? If we can really have an honest conversation about marijuana. Again, it's not to say that there may not be some sort of medicinal use for it. We just don't know.
We don't know. It's still illegal on the federal level, so there aren't good studies,
Right.
research studies to show, what the potential, benefits or adverse effects of long-term use of marijuana. So.
See, when I told y'all, I see dope as dope. Anyhow, caller, speak on it. Yes, caller?
Good evening, Dr. Malik. And
Yes,
you
sir.
as well. It's wonderful, all this intervention being done using the Narcan.
Could you sort of like raise the volume a little bit?
Can
Yes,
you hear
sir.
me now? Can you hear me now?
I hear you, yeah.
Okay, it's wonderful you guys doing all this intervention, but what about in terms of education with young children? Because years ago, they tried in terms of smoking. They had people like Yul Brynner that died of lung cancer, told people don't smoke. And it seemed like they returned back in terms of doing that, having people that have been affected in terms of the negative effect of tobacco smoking. I guess now some of the youth is turning to the, we call this vapor and all that. Why they not putting those type of public service announcements out, and maybe even in school, letting children know the negative effect of using different types of drugs as well? I'll sit back and wait for your response.
Well, I think part of the response is this ship you see on your screen. Submarine, really. It's not talking about the cigarette smoking. It's not talking about necessarily the tobacco and that. But I think what's in it is that capture right there of the amount of dope that was captured by the officials. Because that submarine had millions of dollars worth of dope that had a serious, I think over $200 million street value. And it's back to what you say all the time, that it's all about the money. And I think part of what's happening now, and what we are experiencing and what we are witnessing, I think, at this passage in life, is that people are trying to deal with something based upon economical expediency. And, I don't know how I feel about that, because I think on one end, those of us that was in the field for all the years, we took it serious about all of this, alcohol, tobacco, drugs. And now we finding that, no, it's not really that bad, because we can just write a law. And whatever one of these we want to say is okay for you to do without having the proper research, it's okay.
I think one of the things, we've tried to do at PCC is to normalize the discussion of substance use. At PCC Community Wellness Center, we support patients of all ages, of all developmental stages, so from birth to death. And so we want to start the conversation early with our kids, our teenagers, but also knowing that our older adults who are using chronic opioid medications need to be educated about the impact. So we have done what's called SBIRT, Screening, Brief Intervention, Referral to Treatment. And so what that means is that we ask everybody about their substance use. And if you're not using substances, we're still going to provide you education about why you shouldn't be using substances. And this was an intervention that was developed for the primary care setting, right? Because we know that 80% of adults and even more children have a relationship with a primary care provider. They are really the first line of defense for anybody who's coming in and maybe needs support or education. It's not me as a social worker, it's the people who they go to get their flu vaccine from. And so, we want to catch people before they get to the point of abuse or dependence. We want to catch them at early use, at experimental use, and we want to educate. And we want to continue to educate. And with PCC having integrated behavioral health into all of primary care, you don't have to have a scheduled appointment with me to get support around mental health, substance use disorder. If you come in for your flu vaccine and we do this SBIRT screen and Katie tells me that this adolescent maybe is dabbling with some cocaine use, I'm going to walk right in that room and I'm going to have a secondary conversation after a brief intervention with that patient and do some additional education and support. And so we really try to use all of our resources, our physicians, our providers, our nurses, our MAs, our behavioral health consultants to make sure that at any point in time, whoever you come in contact with at PCC, you're going to get support and education.
Now, where are you all located on the west side?
We've got 12 different clinics.
What number do people call to find out what's closest to them? Maybe that's a better question.
We've got our biggest clinic is at PCC Austin Family Health Center. That's at Lake and Lotus off of the Green Line. We've got right on the other side of Oak Park, we've got our PCC Lake Street. And we just opened our 12th clinic, PCC Parkside Family Health Center at Parkside in Madison, in collaboration with Circle Urban Ministries. And then we've got our chemical dependency clinic, which is located at West Suburban Medical Center. So we're in the old ER. We've treated almost 1,000 patients with opioid use disorder in the last 5 years. We've prescribed Narcan to almost all of those people. And we do that predominantly with Suboxone and with Vivitrol, which is the injection for alcohol use disorder and for opioid use disorder.
Okay, well now you all heard that. Now the truth is, we be trying to make a decision, trying to see whether their 6-year-olds will allow them to stay here and just continue talking, or do they need to get up out of here now because they've basically used the first 25 minutes. I think one of the things that I want to ask about now is this: back in the day when I was a substance abuse facilitator at Bethany Hospital, they had an outpost. Methadone was the hot. Whatever. We can't say it was the cure-all because people were doing meth and whatever. They say they got another substance now that retards the craving.
That's Suboxone.
Okay.
Yep.
And how is that working out as relates to comparison to methadone?
Yeah. So it's just another tool in the toolkit to treat opioid use disorder. But the nice thing about Suboxone is, number one, as Amanda had spoken to earlier, we're able to offer it in the primary care setting. So that's a really important piece of the equation. We look at substance use disorder as a chronic disease, just like diabetes and hypertension, and patients are coming to us for those chronic diseases. So to be able to offer treatment for opioid use disorder and a treatment that's effective is really important. It's a safe medication. It has a ceiling effect, so it's a partial agonist, partial antagonist. So what that means is you don't get those positive reinforcing effects that you may get with a full agonist, such as methadone or heroin, right? You don't get any euphoria. So it's a really safe medication. It has that ceiling effect to prevent overdose. You cannot overdose on Suboxone, and so and again, just being able to offer it in the primary care setting, I think, is key. having that relationship with the patient. And sometimes patients don't, reveal that they have a substance use disorder until months, sometimes years into your relationship with them. But the fact that they, feel comfortable and that we have something effective to offer patients is, that's where we started. We started back in 2011, and it was Amanda and myself and 2 other doctors, and we were offering services maybe 4 hours a week. And here we are in 2019, we offer almost 19 sessions, 4-hour sessions per week. So, yeah, so that just speaks to, PCC's commitment to treating opioid use disorder within the community, but also the need within the community as well. The fact that we've able to expand and, there's just,
And I think, even to expound on that, I think really that primary care relationship is the most important, because PCC's mission is to improve health outcomes for the patients that we serve, and so our patients don't come to us with just opioid use disorder. They come with opioid use disorder and depression and COPD and asthma, and our team of providers and behavioral health consultants and nurses and care coordinators can treat the whole person. So, they're not having to go to 3 separate organizations to get all of their care. As much as PCC can, we've created a one-stop shop. And we've even been able to expand that for our pregnant patients. And this is a really exciting program that we have. We're the only one in the city of Chicago that provides prenatal care, substance use treatment, and behavioral health support for women with substance use disorder who are pregnant. We do their prenatal ultrasounds, their medication-assisted treatment, their behavioral health. We deliver them and their babies at West Suburban, and then we can take care of the entire family unit when they discharge. There's no opportunity to lose them to care. We have peer support specialists who bring their own lived experience to the care team to augment what Katie and I and our teams are able to provide. And as of today, we have 2 of our peer support specialists who will be also trained as doulas, who can support these women who are pregnant and then for a full year into their postpartum period, which is just really exciting and very innovative for the community that we serve.
And that's very good, because I think, quiet as kept, a lot of people don't know where to go, and a lot of them just go deeper into the quicksand. And I think one of the sadness is to be able to have lived through generations, like a lot of people like myself, and see something happening that was happening 40 years ago. And the question or the challenge become, are you accepting the fact that we can just do maintenance for people with substance disorders and allow them to function in society without judging them or putting them in a box?
Yeah, I think it's an important conversation, and it's important, that we're having this conversation to reduce stigma, and that, it's not going to change. It's out there.
It's the bottom line.
And it's getting worse. And so we need to keep talking about it. We need to continue to engage the community and normalize it so that people feel that they can come and get treatment in an environment that's non-judgmental, that's supportive, and that's effective.
Now, you all just bear with me for a minute, because the audience already know that I will snap. now, check what was said. And see, this is what you got to understand. And LaShawn Ford said it at the last press conference we had over there on Central. Ain't no need I'm paraphrasing him, so I don't need y'all talking about he said. I'm saying he said, but I'm saying. Now, look, your family members might have an issue. Ain't no need to talking crazy. You've been talking crazy for 40 years, and they still doing it now. Now what people are doing with this initiative that LaShawn Ford and PCC and others have taken is trying to give you, not the person with the substance so-called disorder challenge, trying to give you an opportunity to have peace. Now feel me now. We're trying to give you relief. Because the practitioners, the professionals already know it ain't going nowhere. So we need to what? Normalize it to the degree that we can provide the awareness that the person don't OD. Bottom line, we trying, according to Mr. Lee and Sean Ford and Brad Cummings and all of the people involved in the West Side Heroin and Opioid Task Force, we trying to make people aware so they don't OD to death. Period. We ain't trying to stop nobody from using no dope. We trying to stop folks from dying. Am I clear? Because you need to keep that message until the next quarter. Because today is the last day of this quarter. So if you can stay alive and keep staying alive, good. If you can get off a substance, good. But they have already told you you're going to need wraparound services.
Yeah. And that's a big mission of our treatment program. We don't know the moment that a patient may decide that recovery or long-term abstinence is their goal. Our goal is to keep you in treatment, keep you coming, and offer support. You may never decide that abstinence is your long-term goal. That doesn't mean you're not deserving of treatment. And so if we can keep you engaged in care, we can help keep you alive. And that is our primary goal. Our secondary goal is always going to be to support those who want it into long-term recovery. But our primary goal is we want you, and I'm going to say it to the camera, we want you alive. Because there's nothing we can do if you're dead.
True. All right, caller, speak on it.
Good evening once again. I have to ask this question, and I'm a little bit of a student of history. China had a real bad opioid problem as well. How did they solve their problem? I don't know whether we should use it or not. Maybe we should try to do what China did in terms of their problem they had as well.
That's a good point. And I used to hear back in the day about China having that type of problem.
Interestingly, China is the largest provider of fentanyl to the United States.
Yeah.
All of the fentanyl analogs come to the United States predominantly from China, some from the Middle East, some through Canada. So it's shipped in through the United States. The analogs are then taken over the border to Mexico. They do whatever they do to it to turn it into the fentanyl that they then bring back over the border to sell. And so it's an interesting dichotomy that China would have solved their opioid crisis while at the same time being one of the predominant contributors to the fentanyl crisis.
See? So Carla, I'm not sure if that quite hit because that is what's real that we need to know. But in the back of my mind, from way back in the day when it was talking about China and how they were dealing with their opium problem, I think those people are treated as outcasts. And somehow it conjures an image in my mind of Skid Row in Chicago. Not so much Jewtown, but Skid Row. Because that was the outcast a few years ago. But now it's no more Skid Row. Why? Because you don't see it. We tore down their huts. Now we got them in little tents, and they still living in viaducts. And I think that's what happened in China, brother. I think they probably still got the problem. They came up with a substance that they are sharing with us here in America that is being used to kill more people. Over 50,000 people in the United States died last year over overdose. And most of it was laced with something that's coming out of China. So on one end, they might have kept them on the low key, and some other things that they do over there that they don't do over here. So I don't really know what they did in China, but I do know that fentanyl over here seemed to be the kickoff to the next level to kill you quick.
Absolutely.
And China has really criminalized substance use disorder. So they put them into treatment hospitals that are in many ways like prisons. And I think in the United States, we're really trying to undo the criminalization, having conversations, because Katie and I have had the opportunity to do some work in Cook County Jail, and the women that we've had the opportunity to work with, many of them, we know 80% of women in the jail have PTSD, right? And so it's not, if we criminalize substance use disorder, we're not treating the issue, which we're not treating the impacts of trauma and violence and the impacts of the communities that these substances are impacting, right? We're not addressing any of that. And if we really want to see a shift in our culture, a shift in our communities, we have to acknowledge that people don't choose to be substance abusers, right?
Right.
Nobody wakes up one day and says, I think I want to be a heroin addict.
Okay.
There are things that impact their lives. There is nothing that takes away the emotional pain of trauma like heroin. And so that's why at PCC, it's really important to us that every patient that come in for treatment also be getting behavioral health. Because if I don't give you the tools to treat the emotional pain that heroin has been treating, we are setting you up for failure. You will go back to use. And then we haven't done our job. And so I think one of my soapboxes and one of the things we really work on at PCC is to recognize nobody chooses to be an addict.
It's not a moral failing.
It's not a moral failing, and that we've got to treat the physical health and the emotional health, behavioral health issues that contribute to the substance use disorder if we want people to have an opportunity for long-term recovery.
You know, that information helped because I think, we all panic. And right now we have been misdirected by thinking that marijuana and all of this and this all over the place. But I'm telling y'all, that might not be the best thing to be doing right now in your family unless you just need some recreation. I suggest you go to the gym, get your health club membership.
We'll always endorse exercise.
That's right. That's what I'm saying. Talking about recreational marijuana. I'm still trying to figure out what's that. I mean, what you mean recreational marijuana? I can understand you saying, well, you're using it because you got glaucoma. I don't know if that work or not, but I heard somebody say if you got glaucoma and you can smoke you some good bud, you'll be all right. I don't know. Y'all know more about that than I do.
Katie, what do you think?
I think, again, going back to, we just don't know, right? Because, again, it's illegal still on a federal level. So we just don't have the information to say yay or nay on this matter. So.
But now you all, now I don't want to get off into y'all business. But you all say PCC. What do the PCC spelled out?
It actually stands for nothing anymore. It's an homage to our originating our origins. PCC used to stand for the Parent-Child Center.
I remember those back in the day. That's old.
That's
We
right.
started
That's
with one exam room or
That's
something in
right.
the hospital.
We were literally birthed out of West Suburban Medical Center, and so we spun out into our own independent LLC. And as an homage or as a thank you to West Suburban, we maintained the PCC in our name.
See, that's why you ask questions. See, sometimes you need to do that because once you remove the mystique, then you can get to the meat. The bottom line is simple. PCC, it catch, but something ain't being said.
There's more there.
It's got to be more there. And I remember back in the day when I was working for Human Services, parent-child centers, that was something that was happening. That was alive. Now you don't hear that. But you hear PCC and you find out today the biggest whatever in Chicago and the only one or whatever. Now you see that it didn't die.
Right.
It just It just moved to another face.
That's
Fluid,
right.
yes.
And that's what's happening with so much in our society, if we can call it this. There's a lot of discussion, a lot of conversation in the community right now. But unless we get on top of what's happening with this recreational piece, and how it fit into the heroin opioid crisis. We just running in circles, y'all. And the sadness for me, and I don't want to get you all in a political thing, but I'm going to just say it, the sadness for me is that we seem to go political for a time. But when the next group of politicians come into play, they will come into play to undo what we might have done. And like you say, if the Fed has not completely said it's okay, we back to another dilemma. There were some people right in the state of Illinois just the other day they were taking some recreational cannabis. Went to work, had to drop, had to have their hair analyzed, and they got fired. Now, they say, well, we live in Chicago, we work in Chicago, marijuana is da-da-da-da-da. The employers say, not up in here. So I say this so we as a people don't get faked out. Your job still might not accept the fact that you can have recreational marijuana. I do another show on another milieu, and somebody called in from work the other night. And he was saying that he really don't want nobody working next to him on the machine that he's on. And they just got through smoking a joint. Because, they know. So the recreational might not be as potentially dangerous as some of us think it could be. But the bottom line is you have people here that are in the game, been in the game for years, providing a lot of services that we have to know about. And how often do you all participate in those, monthly meetings with Lee Rush now, with the task force?
Yep.
Okay. Now, in you all's opinion, how is that coming? Because I understand that task force been in existence, 2 or 3 years?
Yeah, so it started, there was a hiatus, and we're so grateful to Rep. Ford for having reinstigated this task force. I think it's such a necessary component. So we get so wrapped up in our own day-to-day of what we're doing in our own organizations, and we can't treat the community without our community partners. And so the work that Representative Ford is doing to reinstigate this task force is really helping us and our other community partners come together, better understand what we each do, how we can work together, how can we support each other and the patients that we serve, and then to have Rep. Ford there to push the policy that is so necessary to make long-term change. It's just such an important component that we couldn't do without him.
Okay, and I think that's good because I heard something maybe 3 weeks ago where President Trump was releasing $900 million. And I don't know what he's releasing it from. I guess it was in a pot somewhere. I mean, we had a guest on here one day, and he said that they had been to Washington, they got $5 million, da-da-da-woo-woo, and for the opioid thing, and I'm thinking that maybe this is a piece of that. And compare to, I'm going to say downstate, whatever that means, other areas, how out of balance is what's happening in the Chicago area, the West Side area. I don't like to make a distinction between the West Side and the South Side because I go to both every day, and I truly don't see the difference. So is there a similar crisis other than Joliet with this epidemic?
Absolutely.
Yeah. And I like facts. Katie can tell you I like facts, I like data. And Chicago has the highest volume of overdoses, but the rural areas of the state are the hardest hit. They have the highest amount of use per capita. And the challenge is there are so many federally qualified health centers here in Chicago. There are such great community resources. Those don't exist in the volume that they need to in the southern parts of the state, the more rural parts of the state. And so while we may have the highest volume and we're creating essential services to treat these patients, patients in rural parts of the state have almost no access to treatment. They're driving hours to a methadone provider or to a Suboxone prescriber to be able to get the treatment they need.
Yeah, we have patients that come from near St. Louis to access medication-assisted treatment at PCC. So there's just a paucity of services in the more rural areas. And I just think that speaks to the West Side Opioid Task Force and just really expanding access to medication-assisted treatment, not only in Chicago, but also in the rural areas.
Now, let me just, those of you that's watching, and all y'all ain't watching tonight because I know you're at work or you're in traffic. And it's raining out there, but, like I said earlier, if somehow you run across this show and you missed the other ones, all you got to do is go to CAN TV, Nonprofit Services, Retro Current Team, and you can go to the West Side Heroin Opioid Task Force on YouTube, and you can find everything that State Rep LaShawn Ford and them has been doing in this. This woman here, she got a problem. She got popped out there handling that. But look at her. And when I was talking to a barrier about it, she looked more like a victim of meth, more than she looked like a victim of heroin or cocaine. But that's the face that we don't see. What they show you when they talk about this epidemic is the heroin addict that you think is your uncle. Your uncle is not the reason that Trump released that $800 million. That's the reason. And that picture with that little boy and his parents, those are the reasons. So instead of being resistant, that's my point. Instead of being resistant and turning things into what it ain't, think about how fortunate we are that all you got to do is get on the green line and get off the train. That's all you got to do. And they're right there. And if you don't want to do that, because the ones they named on the west side, hell, all of them almost right together. You can get to them. So here we are, got all of these services. Feel me? So we don't have an excuse. We don't have no excuse to have people ODing because the services are here. But those people maybe down in Cicero, I don't know. Hell, I ain't heard of Cicero except down there by Chicago. I mean Cairo. I ain't talking about Cicero. Cairo. Hell, I don't forgot Cairo even existed. Do they still exist? Yeah, a little town back in the day they called Cairo. I bet you some of those little towns down there that we don't never think about, we don't hear about, they got people that suffer.
And, you know, I think if you contact us and we can help you find a service provider that may be in your area too. It doesn't necessarily have to be PCC. We just want people to be able to get treatment. So we have a list of resources. You know, there are websites that list providers, you know, physicians and nurse practitioners that offer medication-assisted treatment all around the country. So just by contacting us, we can get people in touch with appropriate services.
www.pccwellness.org. If you call our West Suburban Walk-In Wellness Center clinic, you can ask for our chemical dependency care coordinators. They always answer the phone. They are always there. Whether you need an appointment with us, if you need to just come in for a one-time appointment to get Narcan, if you need connection to a methadone provider. You know, we're very proud of the services that we offer, and we know that PCC is not the only game in town, and we also know that we're not always the right game in town for the patients that we serve. And so we want to make sure that we connect you to the right support system and the right mode of treatment that's going to get you healthy.
Okay. So I'm saying this, and we got 11 minutes, so they finna just do whatever they want to do with those 11 minutes. They ain't gonna talk because I know they short is trying to figure out, Mama, ain't you gonna say this or that? So y'all just go on and talk among yourselves. I'm gonna sit here and look crazy.
Oh, goodness.
Tell us something we don't know that we need to know.
That's right. That's right.
How did you all get the nerve to just make this happen? Just 2 and 3 folks, and now y'all got this big operation. What was your motivation and what was your motivation, inspiration, they the same. How did you all get the nerve to do this? Because it took nerve to go out here and do this.
I think it came out of need. Back in 2011, when Amanda and I were working together, we were seeing these patients. You know, we were seeing their COPD and their asthma, you know, affected by their opioid use disorder. And we weren't able to offer an effective treatment for their opioid use disorder. So it was happening. And so we just felt like we needed to do something to be able to offer this service. And it just grew from there. I mean, obviously there's a lot of media attention about this opioid epidemic. Here in Chicago, we're really, and especially the Austin neighborhood, we're in the epicenter of it. There's a lot of grant funding to expand services, which we're very grateful for. And so it's just something that has kind of grown very naturally, and we've just been able to add layer upon layer of additional support, as Amanda had mentioned, with peer support specialists, you know, even offering services to pregnant women. So
yeah. And I think, you know, our goal is to listen to what our patients are telling us. And our patients were telling us we need a safe place in the community to come and get treatment. We need to get better our community members are dying. If there's anything that will get to the heart of good social service providers, it's telling us that we're not meeting your needs. And we knew that at that point that there was nothing more we could do than to figure out how to bring the services in-house. And we've been able to do that with all kinds of innovative programming. So PCC was the very first birth center for patients with Medicaid to offer alternative birthing options for women with Medicaid. They're offered the feeling of a home birth with a midwife. We were the first and currently only people to be able to offer substance use treatment to women who are pregnant and also offer their prenatal services. We're very excited that now we're combining alternative and integrated medicine to all of our patients. So bringing in yoga and acupuncture and meditation to really kind of round out the toolbox. Because we don't know that thing, again, that's gonna prompt somebody into feeling like they've got what they need to support those that emotional pain that may be contributing. And if it's a combination of some Suboxone and a little bit of yoga and some therapy, we're going to figure out how to make that happen.
Now, that's very interesting because now, as I listen to this, it reminds me, boy, I sound ancient as hell. It reminds me, but and you all's spirit is sort of free. But it reminds me probably back of something I would imagine in the 60s where people were willing to experiment. They was living in a time when people was feeling something, but they was doing something else. And I think you all don't feel like and sound like the profession that you're in. You sound like you're talking about alternative, integration of alternative medicine with traditional. I mean, I'm talking about some yoga, talking about some midwives. What? You all getting away with that?
Absolutely, we're very successful at it. I can tell you that 75% of our pregnant women who have with opioid use disorder remain engaged with us at 30 days postpartum. I can tell you that the average number of patients who continue engagement after 30 days of treatment is 25%. For us, we have 50% continuous engagement at 12 months. That's absolutely unheard of. And the reason we're so successful is because we have service providers who care. We say, we're never going to ask you to leave treatment because of continued use. We are going to keep you engaged as long as possible, and we are going to figure out whatever it is that you need to be successful. And if that's a new service with PCC, gosh darn it, we're going to try to figure out how to do it. And if it's something we can't do, we're going to bring in a partner to help us figure that out. We're very excited to have a partnership with Healthcare Alternative Systems, HAAS, who comes into PCC and offers intensive outpatient treatment for our patients with substance use disorder. Not a service we're able to provide, but we have a trusted partner, and our patients who need it are getting the services that they need without having to manage the barriers of transportation and childcare and figuring all that out. They come to us, we create a one-stop shop, they get what they need.
And that's good. And I want to thank CAN TV because somehow we have gotten through 2 programs in one night. And that's all right, because what happened is this is a good way to bring this series and this period of time, this quarter to an end, with providing a whole lot of information that allows for a whole lot of services. So, thank you, ladies.
Thank you
Doc,
for having us.
Ms. Amanda, and y'all for looking. And this program will be probably on YouTube. You can, like I said, you can go to CAN TV, Nonprofit Services, Retro Current Team, probably around 4 or 5 o'clock Tuesday, and you can see it. But I know your children been streaming live. They've already seen it, so you don't have to worry about it. So until next time, we out.